If you have knee pain because of a meniscus tear and you're trying to avoid surgery, you're in the right place because I'm going to show you from start to finish what you could do to avoid this and fix it on your own. Guys, what's going on? Dr. Nick Bonforte here to go over all about meniscus exercises that you could do. So I'll be demoing the exercises and I'll be talking through how to perform them, where you should feel it, how many reps and sets. And then after that's completed, I'll go more in depth into a rationalization of why you're doing that particular one. If you want to stick around for that why explanation, then you can, and you can learn more. If not, just skip ahead right to the next exercise so that you could actually be more efficient with your time. So I'm here to help you the best I can. If you want to learn more in depth, it'll be there. If you want to just do the exercises, be sure just to skip ahead to the exercises. Now, real quick, the meniscus lives between the femur bone up top and the tibia bone on the bottom. They act as shock absorbers between your knee for compression from when we're doing loaded things like walking and jumping and things like that. They can get irritated from traumatic events, and they typically get irritated from a compression rotation standpoint. So that's when the meniscus irritation typically happens. Now there's many other causes, but that's most common from compression and rotation. Now, when we go about these, we can conservatively treat them without a surgical procedure. So this video is going to be more along the lines of conservative treatment. Now, depending on how severe the meniscus tear is, that could be depending on what you potentially have going on, and we have zones of the meniscus. The deeper the meniscus tear is within a zone, that's harder to treat conservatively, but it's still possible to live your life with a complex tear, just depends on how you're coping with it. This video is going to be focusing on more of the conservative side when you have more of tears to the outer edge of a meniscus issue. So let's get to it. This is the knee dangle. So you want to take a weight that is sufficient enough where you feel it's actually pulling your leg a little bit. So you're going to have gravity and the weight pulling your leg further into traction forces at your knee. You should just feel a slight tugging sensation in the knee joint. And with this, you want to go either front and back and side to side, making little circles with the knee or the lower leg, or oscillating back and forth. The idea is not to aggressively kick your leg back and forth or go big circles. Go very minimal front and back circles, and the idea is to get more time under tension to cause some traction forces at the knee. You want to build up anywhere up to 5 minutes. When in the beginning, when you have meniscus irritations, I like to do this multiple times per day, 3 times a day, 4 times a day. More input, the better with this exercise. So with the knee dangle exercise, the rationalization behind it is when we have weight on our ankle and our foot, and we have gravity, it's hanging off the edge of the table, and we have gravity also pushing our leg down, we're creating that traction force that we need at our joint. Why is that important? Because meniscus irritation typically gets irritated from compression forces. So the idea with the knee dangle is we create that traction in the joint to give it some space. That's one. Also, two is you got to think about it like a towel that's filled with water. When we have a towel that's filled with water and we wring it out, we have all this fluid that comes out of the towel. So the joint capsule around our knee, when we cause traction to it, it kind of acts like that ringing effect. We create traction to the joint capsule and we help get fluid in and out of the joints. That's important because when we have some low-level inflammation or swelling at the knee joint, it helps get fluid dynamics in and out, ultimately helping swelling and getting also nutrient components to the knee for some healing. So the knee dangle is a super simple one to actually do multiple times, and you can get some really good pain relief and benefits from an exercise just like that. So with this exercise, we're taking a towel or a shirt, you're wrapping it up, and you're putting it behind the knee and pulling. So that will create a little bit of a gapping technique. So this first one, I'm on my hands and my knees, and I'm gonna have that towel in between that joint crease, and I'm pulling forward as I rock back. This creates a little bit of a traction force as well, and also gapping to the knee, so that it creates the ability to actually go into more knee flexion. Because when we have meniscus irritation, deep flexion typically gets irritated because the meniscus is getting pinched. So by using this one, we're going in as far as we can to the range of motion motion and back out. With this, I like reps. So 3 sets of 20, 30, 4 sets even. If being on your hands and your knees isn't as comfortable, you could also perform this just on your back, and you perform the same concept. You have the towel, you pull it up, and you're creating the knee gapping moment. So you want to keep that pressure throughout the whole time. And again, reps even in the modified position. And this I like typically more throughout the day, 3 times, 4 times, until you start to get the symptoms simmering down. So the knee gapping is a go-to that I use for meniscus irritation, and it works really well because when we have meniscus irritation and we go into deep knee flexion, whether it's swelling or inflammatory factors, or you're actually pinching on the meniscus, it just gets irritated. So by using this technique, we help create a gapping force as we bend our knee, and it creates a little bit of a traction force as well. So we have but the biggest thing is you have to make sure you're actually pulling and putting pressure through that joint space. If we're just putting a towel and we're not really having much pressure, it'll be not as effective. So we want to make sure we're pulling hard so that you can actually get that gapping technique. And the idea and the rationalization behind it is it creates that gapping effect, so when you go into knee flexion, it doesn't pinch on the meniscus as much. And also, like the first exercise with the knee dangle, with the traction forces, it helps flush out some fluid. So by doing the knee gapping technique, it's kind of like a 2-for-1 where we're getting some traction forces and gapping techniques to it, so we could ultimately bend the knee a lot better. So this exercise is tibial internal and external rotation. You have a slider underneath your foot. It doesn't even need to be a slider. You could be on a wood surface with a sock. Your foot could be on a towel. Anything that you can have a slippery surface that you can actually move throughout this. Now the idea is you want to have your hands on the side of your knee so you're stabilizing it, because you don't want your knee moving throughout this. You want to stabilize the knee and just have that good mind-body connection of focusing on the lower part of your leg moving. Now yes, your ankle will be moving, but you don't want to emphasize and think about getting your ankle to go further in. You want to focus on the ankle, foot, and the lower leg being one unit as it rotates in and out, because that's the idea. We're trying to rotate the actual knee joint, but a lot of times we'll compensate at the ankle and the foot. And with this, I like reps as well. 3 sets, 10, 12, 15, 20, and then performed multiple times per day. Now the idea working on tibial rotation is because meniscus irritations and tears typically happen, like if you remember from the beginning, from compression and rotation. So if we get better rotation at the knee, we have more room to spare us. So the thing is though, in life, we don't really focus on working on rotation at the knee. So we lead to these compensations and we have increased stress to different areas of the knee because it doesn't rotate well. So by making it rotate better, it helps give us some slack to the area. That's one. And then 2, just making it rotate better is helping localized actual movement at the knee, which also helps for fluid dynamics, getting in and out of the actual joint. So with this, you want to make sure you're working strategically on rotating the actual bottom of the leg without compensating. It's very common to curl the toes when we do this and not perform it correctly because we're trying to get into a range of motion. You want to go into the ranges of motion that you can actually obtain and work on getting them better. So focusing on really 3 points of contact with that, the big toe, the pinky toe, and the heel, as like almost a foot tripod as you're going in and out throughout this actual exercise. The glute bridge. You want to make sure your toes are off the table and you're driving through your heel, and you want to think about feeling your glutes and your hamstrings, really emphasizing to get yourself up into the air. So you should be feeling the posterior chain working in this case. With the glute bridge, I like to get reps with this, and you could also get some duration with this as well. So as an example, as you come up, you could hold that position for a period of time, 5 seconds, 10 seconds, to get more work being done to the actual glutes and the hamstrings. So with this, 3 sets of 12, 15, and each rep could maybe have a 3-second pause. So as an example, if you do 3 sets of 10, each rep has a 3-second pause. That's 30 seconds of actual work being done in one set. Then you do 3 sets, that's 1 minute and 30 of actual work being done. So focus on the form here and the reps and maybe even tempo with this one. Next one up is the classic glute bridge. This can get overlooked because it looks simple, but you gotta do it right. So with this exercise, I'm on my back and notice my feet. My feet are off the ground, so my toes aren't down, because it will help emphasize more of the posterior chain, the glutes, the hamstrings, and it makes you force yourself to push through your heels to really emphasize that stuff working. Versus if the toes are pointing down and you go up into a bridge, you're typically gonna actually emphasize more of your quads. And that's not the idea with a glute bridge. You wanna work on the posterior chain of it. So with this, toes up, as you drive through your heel, you wanna raise your pelvis all the way up throughout this exercise, and you wanna make sure you're emphasizing the glutes working, feeling your glutes and your hamstrings working. Now you might feel more of your hamstrings working versus your glutes, and that could be what's called hamstring dominance, but it's still a good idea to work on these things because you're working all of the stuff that brings your pelvis up into the air throughout this. So this is a good one for just a strength stabilization standpoint. And at the knee, you're not moving it through a dynamic movement, you're just stabilizing it in one position and actually working things around the actual knee. When we have meniscus issues or anything at the knee, just localized focus work at the knee in later stages especially, is missing the big pieces to the puzzle. Sure, in the beginning, you wanna really focus on knee-specific stuff, but as you start to do other things, you wanna work around the stuff. Below and above the actual knee is a good one. So in this case, we're working above at the hips to ultimately help down the chain at the knee. So the split stance pendulums, this one we are gonna be emphasizing more work being done on that front leg. So you wanna focus on putting a lot of pressure on that front leg, and the back leg is just there for some tippy toe support. Now with this, you have a slight knee bent position. You maintain that, you lean your chest forward a little bit. This will really emphasize the hips and the whole leg from a stabilization standpoint. Now with the kettlebell, you're just gonna go side to side, nice and easy throughout this. Now you don't wanna go to a whole shoulder lateral raise, just go a little bit to the side for each one. Now throughout this, you're focusing on the big toe, the pinky toe, and the heel, creating that foot tripod on the ground and stabilizing yourself throughout this. With each swing, you'll feel yourself kind of being knocked off balance. So you wanna make sure you're stabilizing with the leg, the whole leg and foot throughout this. Reps here as well, 3 sets, 15 to 20 total swings. So like 1, 2, 3, 4, and you build up to about 20 reps. So you get at least good input to the system. All right, so the idea behind a split stance pendulum, one, is just a factor from a single leg or a biased single leg stability and stabilization. Now, a lot of times with knee issues or meniscus tears or whatever's going on at the knee, a lot of times we lack just stabilization and strength on one leg. So with this one, yes, we're not on one leg, but we're help biasing that one leg input. So you can monitor the pressure that you have with that back foot. And the idea is to build up that single leg focus and strength and stabilization. Most of walking is one leg. So everything with running is one leg. So the idea is to build up a lower level activation one from a stabilization standpoint, like doing this one, to really help engage the hips and the whole leg. When done right, it's actually a very challenging exercise, and you don't have to use a lot of weight because when you're in a good position, swinging side to side will throw you off balance. So it has to create more of a reaction standpoint for your whole leg. If you're pushing your weight to the inside, your muscles have to react to that to stabilize you, vice versa to the outside. This is good because it goes into functionality in life, because in life when we're walking, we go off of a curb, we get into a ditch, we turn our foot, we have to stabilize our foot, so it helps kind of prep ourselves for that with that particular exercise. All right, the classic squat. We're doing tempo here. So we're going down slow and then pausing for a little bit, whether that's 2 seconds, 3 seconds, 5 seconds. You wanna get a little bit of a pause at the bottom and then you come back up. Now I'm just using body weight here. Now with irritation to the meniscus and the knee, weighted goblet squats, depending on what stage you're in, you wanna progress up to. You don't wanna just hold 100 pounds and start doing goblet squat. Build up to it and don't overlook how effective body weight exercise can be. So this slow and steady tempo incorporated, especially in the beginning, and you want to build up to weighted. With this, reps as well. 3 sets of 12 to 15, especially just getting your body moving. And then as you start to get heavier and heavier with weights, then you can manipulate where you maybe go 10 sets, I'm sorry, not 10 sets, 3 sets of maybe 10 reps on one set, 8 reps on the next set, 6 reps on the last set. That would be more of a strength-focused block. But with the beginning, like I said, more reps to get the body moving and fluid throughout this. Now the idea with performing a goblet squat is to create more functionality to this. A lot of times with meniscus irritation or knee issues, we'll tend to, if squatting hurts, we tend to avoid squatting. We don't want to avoid things. We want to start to microdose things into our routine so that we can actually keep ourselves moving. We don't want to just wait to this arbitrary timeline of, oh, I feel a lot better, let me try squatting now. And then you go back into it and then something sparks up again. So by doing something as simple as a body weight squat with no weights and adding tempo can really get you going in the right direction. In this one, I just did body weight and I did tempo to this. So you'll notice when I go down to a squat, it's slower. It's 2 seconds down or 3 seconds down, and then I pause for a little bit. I don't just sit down and then I come back up. I pause where I don't sit, so I'm creating tension in my legs, and I put input into my legs, and that also has a pain relieving effect. You get more tension into your legs from a standpoint that's not overloaded, it tends to reduce the pain. So the idea is to get your body moving, and you use tempo squats like the one I did in this one to really get the ball rolling in the right direction. And then once you start to feel like you're getting stronger, less pain, then you can add some weights and get more into higher level stuff. But one of these simple looking exercises really gets overlooked in the beginning, and it can be really effective, especially if you add some tempo into this. So there you go. Those are some of my go-tos that I use when dealing with knee issues like a meniscus tear. Now, are these all encompassing like the ones you should be doing at the end with performance and everything like that? Of course not. These are more the conservative ones that you want to start with, especially in the beginning phases, to really reduce the symptoms, reduce the pain, to get everything moving so that you could build off of these things, especially the ones in the beginning, the gapping, the dangle. Those are really good, even the rotational, those are really good to get the localized knee moving and less discomfort from a joint perspective at the knee. And then focusing on simple ones like the glute bridge or a stabilization one, and then a functionality one like the goblet squat. Those get you moving throughout this with just a low intensity where you're not gonna be aggravating things too much. So hopefully you gained some insight with this video and learned some things throughout this. If this was helpful for you, I'd greatly appreciate it. If you subscribe down below to the channel, it really means a lot to me, and I'll see you on the next one.